Hi everyone, Dr. Kalaiko here, and I want to give you an update regarding the Johnson & Johnson or Janssen vaccine following my latest video. Now, first of all, some overall news regarding the pandemic. So, cases are slowing down in some areas and accelerating or surging in others, depending on where you live. So, this pandemic is far from over. Now, the good news overall in the US, a little over half of all adults have received at least one dose of their vaccine. So that's great news. That means we're making good progress. Now, of course, there's variation from state to state and county to county, so there's still a lot of work to be done before we reach herd immunity. So we unfortunately had a slowdown in vaccinations over the past couple of weeks when we received reports that there were 6 cases of a very rare but serious type of blood clot in mostly young women who had received the Janssen or Johnson & Johnson vaccine. And for more information on that, you can see my previous video that I posted. Now, some good news over the weekend is that the CDC and the FDA have officially lifted the recommended pause on the J&J vaccine. And what happened was the CDC Advisory Committee on Immunization Practices, or ACIP, met for 6 hours last Friday to deliberate and discuss the data that we have available. And some of the most compelling information on this came from Dr. Sarah Oliver, who presented a model showing the benefits versus the risks of the J&J vaccine. So in this model, it showed that if we resume the J&J vaccine for all adults age 18 and up over the next 6 months, they projected that possibly we might see an additional maybe 26 cases of this type of blood clot out of nearly 10 million vaccinations. However, we would prevent over 1,400 deaths and over 2,200 ICU admissions. Now, if we were to resume the vaccine for only adults age 50 and older, we might see 2 cases of this type of blood clot out of 3.6 million vaccinations, and we would only prevent 257 deaths and about 779 ICU admissions. So that was pretty compelling data in terms of weighing the benefits of this vaccine against the risks. So again, this type of blood clot was very serious. However, if healthcare professionals know how to identify, run the appropriate tests, and treat it appropriately, then it becomes much more treatable and manageable. And so part of the benefit of pausing this vaccine was to educate healthcare providers on how to treat this type of blood clot. Preferably the patient would be referred to a specialist like a hematologist that is familiar with these types of blood clots, and they would not be treated the same as your typical blood clots. It's a very different type. So no heparin, for instance. And so with this knowledge, the healthcare providers can ensure that patients can be treated safely and effectively if this comes up. Now, when we talk about risk versus benefits of any vaccine or any medication or really any healthcare intervention, we have to ask, is this safe and effective, and for whom? So looking at specific populations of people. So what we saw with this Janssen vaccine is that this type of blood clot was occurring mostly in younger women under the age of 50. So if you fall into this demographic, you should know that this type of blood clot, it is serious, but it is still very rare. And you do have other options for vaccines, like the Pfizer vaccine and the Moderna vaccine, that do not have an association with this blood clot. So that's important to know when you're making a decision of which vaccine to get. And when you go online to make your appointment for a vaccine, many of the websites, depending on the jurisdiction or the state that you live in, you can filter by the brand or the type of vaccine that you're looking for. So we are fortunate, in the US, for example, to have several options for very safe and very effective vaccines against COVID-19, which is, again, a very deadly and serious virus. And so it's important to keep up the word of mouth. If you were fortunate enough to already receive your vaccine, please encourage your friends, your family, your neighbors, your coworkers, all of those that are in your circle to get their vaccine too. And you don't have to engage in a big long debate or anything like that. Just by planting seeds and encouraging people and setting an example by showing that you received yours safely is enough. So thank you for listening, and I'll see you next time.